North Korea's healthcare system defies every assumption you might have about medicine in one of the world's most isolated countries. While headlines focus on nuclear weapons and political tensions, a remarkable medical infrastructure operates behind closed borders, one which combines cutting-edge telemedicine networks with 5,000-year-old traditional healing practices. The average North Korean lives to 73 years old, which surpasses the global average and matches countries with far stronger economies. Even more surprising, the leading causes of death are not infectious diseases or malnutrition, as most people assume, but rather heart disease, stroke, and other conditions typically associated with wealthy nations. This medical paradox reveals itself through a system built on socialist ideals that promised free healthcare for all, yet now operates largely through underground markets where patients pay doctors with cigarettes and rice. Every North Korean citizen receives a dedicated family doctor through the section doctor system, a concept which has impressed even World Health Organization officials. Yet those same patients might undergo surgery without anesthesia because hospitals lack electricity and essential supplies. The story of North Korean healthcare is not simply one of success or failure, but rather a complex web of innovation and decay, traditional wisdom and modern technology, official propaganda and desperate improvisation. What if every person in your country had a dedicated family doctor who knew their medical history from birth and visited their home regularly? North Korea actually achieved this through their section doctor system, which began in the 1960s and remains one of their most successful healthcare innovations. The system works like this. Every doctor takes responsibility for approximately 120 households, or 400 to 500 residents. These doctors maintain detailed health records for each person, documenting everything from childhood vaccinations to chronic conditions. The records grow thicker each year, creating comprehensive medical histories that follow citizens throughout their lives. Section doctors spend their mornings treating patients who visit clinics, but afternoons are reserved for house calls and community health activities. They conduct quarterly medical examinations for every person in their assigned area, often discovering diseases that patients themselves don't know they have. This proactive approach to healthcare emphasizes prevention rather than just treatment. The system extends beyond individual households to workplaces as well. Large factories and industrial facilities have their own dispensaries with dedicated workplace doctors who provide 24-hour medical coverage. This dual approach ensures that North Koreans receive medical attention both at home and at work. What makes this system particularly impressive is its comprehensive coverage. Unlike healthcare systems that focus primarily on treating illness, the section doctor approach prioritizes keeping people healthy through regular monitoring and preventive care. The World Health Organization has praised this model as superior to systems where individuals must find and pay for their own doctors. However, the effectiveness of section doctors depends entirely on having adequate resources, medical supplies, and functioning infrastructure. When these elements break down, even the most dedicated doctors cannot provide proper care. How can a country maintain impressive health statistics while simultaneously struggling with basic medical supplies? This contradiction lies at the heart of understanding North Korean healthcare. On paper, North Korea's health outcomes look remarkably good. Life expectancy has consistently improved over decades, reaching 73.64 years by 2023. The under 5 child mortality rate stands at 17.3 deaths per 1,000 live births, compared to 2023, an average of 67.6 deaths in low-income countries. These numbers suggest a healthcare system that actually works. The disease profile tells an even more surprising story. Instead of infectious diseases dominating as expected in a developing nation, North Korea faces a disease burden similar to wealthy countries. Cardiovascular disease is the leading cause of death, followed by stroke and chronic respiratory conditions. Non-communicable diseases account for 2/3 of all deaths, a pattern typically seen in developed nations rather than isolated, sanctioned countries. Yet beneath these impressive statistics lies a system in crisis. The economic collapse of the 1990s, known as the Arduous March, fundamentally transformed North Korean healthcare. Hospitals lost electricity and heating. Medical equipment broke down without replacement parts. Pharmaceutical supplies dwindled to almost nothing. The result is a two-tier system that the government doesn't officially acknowledge. Elite hospitals in Pyongyang maintain modern equipment and well-trained staff for the country's leadership and upper classes. Meanwhile, regional hospitals operate more like field medical stations, lacking basic supplies and reliable electricity. This disparity creates a healthcare lottery based on geography and social status. Urban residents, particularly those in Pyongyang, receive care that resembles modern medical practice. Rural patients might wait months for treatment or travel hundreds of miles to find functioning equipment. The collapse of free universal healthcare created something the North Korean government never intended: a thriving medical black market that now dominates actual healthcare delivery. Officially, North Korea still claims to provide completely free medical care to all citizens. The reality involves a complex system of informal payments that make healthcare accessible only to those who can afford it. Patients routinely pay doctors with rice, alcohol, cigarettes, or cash for basic consultations. More serious procedures require substantial payments in hard currency or valuable goods. Surgery costs vary dramatically based on complexity and risk. Female sterilization surgery costs approximately 3 million North Korean won, while removing uterine cysts costs 4 million won. These amounts represent months or years of income for average citizens, effectively making surgical care unaffordable for most people. The informal payment system extends beyond doctor fees to include all aspects of medical care. Patients must often purchase their own medications, medical supplies, surgical materials, and even anesthesia. In some cases, patients bring their own cotton, dressing materials, antibiotics, and pain medications to surgery. This economic reality has transformed patient behavior in unexpected ways. Many North Koreans bypass doctors entirely, going straight to markets to buy medications and self-medicate based on their own judgment or advice from market vendors. It's common for people to take highly addictive narcotic painkillers for simple ailments like common colds. The market-based system also affects medical training and career choices. Doctors supplement their official salaries through private payments, creating incentives to focus on procedures and treatments that generate income rather than preventive care or public health measures. While Western medicine struggles with supply shortages and infrastructure problems, traditional Korean medicine has experienced a remarkable renaissance in North Korea. This revival combines cultural pride with practical necessity, creating a unique medical hybrid that exists nowhere else in the world. Koryo medicine, as traditional Korean medicine is called in North Korea, now accounts for 70% of primary healthcare services. This dramatic shift reflects both government policy and practical reality. When imported pharmaceuticals became unavailable due to sanctions and economic collapse, traditional remedies filled the gap. The integration goes far beyond simple substitution. All medical practitioners in North Korea receive training in both Western and traditional medicine, making them qualified to practice both approaches. This dual competency allows doctors to combine acupuncture, herbal treatments, and manual therapy with conventional medical procedures. Research institutions throughout the country study traditional medicine applications for modern health problems. The Academy of Koryo Medical Science in Pyongyang leads research into using traditional treatments for cancer, cardiovascular disease, diabetes, and other chronic conditions. These efforts have produced treatment guidelines that integrate herbal medicine with conventional therapy. The emphasis on traditional medicine also serves political purposes. The government promotes Koryo medicine as an example of Korean self-reliance and cultural superiority. This messaging fits perfectly with the Hushi ideology that emphasizes independence from foreign influence. However, the increased reliance on traditional medicine raises questions about treatment effectiveness and safety. While many traditional remedies have proven therapeutic value, others lack scientific validation. The combination of untrained market vendors selling herbal remedies with desperate patients seeking affordable treatment creates potential dangers. Few people would expect North Korea to operate sophisticated telemedicine networks, yet the country has quietly built digital healthcare infrastructure that connects hospitals across the nation. This technological achievement demonstrates North Korea's capacity for innovation even under extreme economic constraints. The National Telemedicine Network launched in 2010, connecting Kim Man-yu Hospital in Pyongyang with 10 provincial medical facilities. The system allows specialists in the capital to consult with doctors in remote areas, providing expertise that would otherwise be unavailable outside Pyongyang. Telemedicine serves multiple functions in the North Korean context. It helps overcome the geographic barriers that make specialist care inaccessible to most citizens. The system also maximizes the value of scarce medical expertise by allowing a small number of specialists to serve patients throughout the country. The technology represents a practical solution to infrastructure limitations. Rather than building new hospitals and training specialists for every region, telemedicine distributes existing expertise more efficiently. This approach aligns with North Korea's emphasis on self-reliance and efficient resource utilization. However, the telemedicine network faces the same infrastructure challenges that affect other aspects of North Korean healthcare. Unreliable electricity, limited internet connectivity, and equipment maintenance issues constrain the system's effectiveness. Rural hospitals might have telemedicine equipment, but lack the power or connectivity to use it consistently. The existence of telemedicine networks also reveals North Korea's strategic thinking about healthcare delivery. Despite international isolation and economic sanctions, the country continues to invest in technological solutions that could eventually transform medical care delivery. The construction of Pyongyang General Hospital represents North Korea's most ambitious healthcare project in decades, revealing both the government's healthcare priorities and the practical challenges of building modern medical infrastructure under sanctions. Construction began in March 2020 with great fanfare and political symbolism. Kim Jong-un personally attended the groundbreaking ceremony and set an ambitious deadline of just 200 days for completion. The hospital was designed to open in October 2020 to commemorate the 75th anniversary of the Workers' Party of Korea. The project's location carries significant political meaning. The hospital sits between two important monuments, the Party Foundation Monument and the Mansudi Grand Monument. This placement symbolically links healthcare achievement with political power and ideological commitment. The hospital's design features modern amenities that would be impressive in any country. Plans include 30 modern operating rooms, emergency departments, specialized treatment facilities, patient services areas, and even a helicopter landing pad for medical emergencies. The scope suggests intentions to create a medical facility comparable to those in developed nations. However, the project immediately encountered the realities of building complex infrastructure under economic sanctions. Construction materials became difficult to obtain. The COVID-19 pandemic disrupted supply chains and labor availability. The ambitious 200-day deadline proved impossible to meet. By 2025, 5 years after the original groundbreaking, the hospital neared completion but still lacked essential medical equipment. The building's exterior was finished, but installing and testing medical devices remained incomplete. This equipment shortage reflects the broader challenge of acquiring sophisticated medical technology under international sanctions. The hospital project reveals the gap between North Korean ambitions and practical limitations. The government can mobilize resources to build impressive medical facilities, but equipping those facilities with modern technology requires international cooperation that sanctions make difficult. Tuberculosis tells the story of North Korean healthcare in microcosm, showing how international cooperation, sanctions, and resource limitations interact to create public health crises that extend far beyond North Korea's borders. North Korea has faced a severe tuberculosis epidemic for decades. The country reports among the highest TB incidence rates in the world, with 345 cases per 100,000 people in 2011. This rate far exceeds South Korea's 100 cases per 100,000 and reflects the broader challenges facing North Korean public health. The tuberculosis situation became particularly acute after 2018, when the Global Fund to Fight AIDS, Tuberculosis, and Malaria suspended its assistance programs in North Korea. The Global Fund had provided 115 billion Korean won to North Korea since 2010, making it the country's primary source of TB treatment resources. The funding suspension occurred because the Global Fund couldn't verify that aid was reaching intended recipients. International sanctions made monitoring and evaluation extremely difficult, leading donor countries to question whether their contributions were being used effectively. The organization faced pressure from board members in donor nations to demonstrate accountability. This situation created a public health emergency that extended beyond North Korea's borders. Tuberculosis doesn't respect political boundaries, and drug-resistant strains developed in North Korea could easily spread to neighboring countries through trade, migration, and other contacts. The crisis was eventually resolved through South Korean diplomatic intervention. After South Korea doubled its contributions to the Global Fund in 2019, the organization resumed tuberculosis and malaria programs in North Korea in 2019, January 2020. This resolution demonstrated how international health cooperation can transcend political tensions when public health security is at stake. The tuberculosis case illustrates the complex relationship between humanitarian assistance and international sanctions. While sanctions aim to pressure political change, they often create unintended consequences for public health that affect not just North Korean citizens, but regional health security more broadly. The status of women's health care in North Korea reveals some of the system's most troubling failures, while also highlighting areas of relative success. This complex picture emerges from examining both official statistics and the lived experiences of North Korean women. Maternal mortality statistics suggest relatively successful outcomes. North Korea's maternal health indicators compare favorably to other low-income countries, reflecting investments in prenatal care and delivery services. The Section Doctor system ensures that pregnant women receive regular monitoring throughout pregnancy. However, these positive outcomes mask significant challenges that women face in accessing reproductive health care. Family planning services remain limited, and contraception can be difficult to obtain. The informal payment system makes gynecological care expensive and often unaffordable for women from poor families. The underground medical economy particularly affects women's health because many reproductive health services require specialized equipment and procedures. A woman needing surgery for uterine problems faces costs that could exceed several years of household income. Some women die from treatable conditions simply because they cannot afford care. Childbirth presents particular challenges in areas outside Pyongyang. While the capital maintains well-equipped maternity hospitals, rural facilities often lack reliable electricity, heating, and essential supplies. Women might give birth in facilities that resemble field hospitals more than modern medical centers. The emphasis on traditional medicine creates mixed outcomes for women's health. Traditional Korean medicine includes herbal treatments and practices specifically designed for women's health issues. These remedies can be effective and affordable alternatives when modern medical care is unavailable. However, relying on traditional medicine also carries risks, particularly for complex reproductive health problems that require surgical intervention or modern pharmaceuticals. The combination of limited access to modern gynecological care and increased reliance on traditional remedies creates a healthcare environment with significant uncertainties. International sanctions create a fundamental dilemma for North Korean healthcare. How to maintain medical services while being cut off from global supply chains for essential medical equipment, pharmaceuticals, and technology. Sanctions specifically exempt humanitarian aid, including medical supplies and equipment. However, the practical implementation of sanctions makes it extremely difficult to import medical goods. Financial restrictions complicate payments for medical equipment. Shipping limitations affect the transport of medical supplies. Verification requirements create delays that can make time-sensitive medical supplies unusable. The sanctions' impact extends beyond immediate supply shortages to affect the entire medical infrastructure. Hospitals cannot obtain replacement parts for existing equipment. Medical devices break down and cannot be repaired without access to international technical support. Pharmaceutical production suffers from restrictions on importing raw materials and manufacturing equipment. These limitations force North Korean healthcare to become increasingly self-reliant, but medical self-sufficiency is extremely difficult to achieve. Modern medicine requires global supply chains for everything from basic pharmaceuticals to sophisticated diagnostic equipment. No country, regardless of resources, can produce all necessary medical supplies domestically. The sanctions dilemma becomes particularly acute during health emergencies. The COVID-19 pandemic demonstrated how quickly medical supply shortages can become critical. North Korea's response to the pandemic involved extreme isolation measures, partly because the healthcare system lacked capacity to handle a major disease outbreak. International humanitarian organizations face constant challenges in providing medical assistance to North Korea. Each shipment of medical supplies requires extensive documentation and approval processes. The time and bureaucratic complexity involved in delivering aid can make emergency medical assistance ineffective. This situation creates a policy paradox. Sanctions intended to pressure political change may inadvertently strengthen the North Korean government by making citizens more dependent on state-provided services while simultaneously making those services less effective. The future evolution of North Korean healthcare depends on resolving fundamental tensions between political isolation and medical interconnectedness, between traditional self-reliance and modern medical technology requirements, between centralized control and efficient healthcare delivery. Several scenarios could shape future healthcare development. Continued international isolation would likely accelerate the trend toward traditional medicine and self-reliant medical approaches. This path might produce innovations in combining traditional and modern medicine, but would also limit access to cutting-edge medical technologies and treatments. Gradual international engagement could transform North Korean healthcare through technology transfer, medical education exchanges, and infrastructure development. South Korean medical expertise could play a particularly important role given shared language and cultural background. Chinese medical technology and pharmaceutical production could provide more accessible alternatives to Western medical suppliers. The integration of artificial intelligence and digital health technologies presents interesting possibilities for North Korean healthcare. The country's existing telemedicine infrastructure could expand to include AI-powered diagnostic tools, electronic health records, and remote monitoring systems. These technologies could help overcome geographic barriers and maximize the effectiveness of limited medical expertise. Climate change and environmental factors will likely create new public health challenges that North Korean healthcare must address. Air pollution, water quality issues, and changing disease patterns will require adaptive responses that the current system may struggle to provide. The role of traditional medicine in future North Korean healthcare remains an open question. The integration of Koryo medicine with modern medical practice could produce unique therapeutic approaches that might even benefit global medical knowledge. Alternatively, over-reliance on traditional medicine could limit treatment effectiveness for complex modern health problems. Demographics will shape future healthcare needs as North Korea faces an aging population similar to other developed countries. The current disease profile, dominated by non-communicable diseases, suggests that future healthcare needs will focus more on chronic disease management and elderly care rather than infectious disease control. The ultimate future of North Korean healthcare may depend on broader political developments. Healthcare cooperation often serves as a bridge between hostile nations because medical needs transcend political boundaries. Collaborative healthcare projects could potentially create pathways for broader diplomatic engagement while immediately benefiting North Korean citizens. Whatever the future holds, North Korean healthcare will likely continue to reflect the country's broader characteristics. Innovation constrained by isolation, ambition limited by resources, and human needs that persist regardless of political circumstances. The system's evolution will remain a compelling example of how societies adapt medical care to extreme circumstances while struggling to balance ideological commitments with practical healthcare requirements. The story of North Korean healthcare ultimately transcends politics to reveal fundamental questions about medical care delivery, international cooperation, and human resilience. As the world faces new health challenges that cross all borders, understanding how isolated healthcare systems function becomes increasingly relevant for global health security and humanitarian cooperation.